With the state in phase 3 of reopening, Boston has recently increased free testing for the coronavirus. Some of the testing is aimed at populations where infection rates have been higher, but the results can also guide policy for more progress on reopening. To bring us up to date is the Mayor's Chief of Health and Human Services, Marty Martinez. Thank you very much for being with us, Chief.
Absolutely. Thanks for having me, Chris.
Chief, the free testing has been going on. This is in multiple neighborhoods in Boston, aimed at multiple populations. What's the overall strategy for this?
Yeah, absolutely. The overall goal is to not only make sure that all neighborhoods have access to testing, but it's also to bring testing to people. So the point is to ensure, although we've lifted out testing at community health centers all across the city, we also want to make sure that if people aren't going to go to a health center, they might be more likely to go to the park down the street, or folks that are living in our Boston Housing Authority buildings can get tested right there at the building. As you also know, we recently lifted up a 2-week site at the Jackson Man Community Center, so that we could make sure that folks in that neighborhood and the 2 neighborhoods of Austin Brighton could get greater access. So it's about creating greater access in those areas, either with higher rates or low testing itself.
Part of this is, I think, especially vigorous effort aimed at the Latinx populations in Boston. Can you tell me a little bit about that?
Yeah, we have seen an increase in the positive test rate within the Latino community over the past basically 6 weeks, 6 to 8 weeks. We've seen that increase positive rate. So as we've seen it climb, it's about 28% of all cases in Boston are from the Latino community, when their population is less than about 18%. So we've seen that a disproportionate number of cases. So we've not only prioritized that in partnership with community organizations, community health centers that serve a large percentage of the Latino population, but also organizations who have experience working in the community, so we can make sure that the messages are getting out there about getting tested, wearing facial coverings, and keeping social distance. It's been really key for all communities, but especially those most disproportionately impacted.
One thing that's been picked up before about areas with higher infection rates is you're more likely to find housing units and more people per household. Has there been any thinking about ways to, let's say, provide more isolation opportunities, even helping people relocate to other areas if they're at high risk?
Yeah, it's definitely been a part of it. I mean, I think one of the challenges has been that overcrowding sort of in housing situations make it more likely that you can impact others or infect others. And that's been true. We've seen households where multiple people in the household have tested positive. So what we've done and have been doing throughout the virus has been to be able to connect folks to care, either through our community health centers, or also when we were able to connect folks to additional resources, so that if they couldn't go home and isolate, were there other opportunities for them to do that? We partnered with the state. The state has a couple different hotels where there's an option to do that. But it's actually just as important to make sure people understand you can isolate at home, but what does it mean to isolate from others that you live with? And how do you keep things separate? How do you make sure that you're sanitizing and cleaning as appropriately? So the housing situation is a big deal, and actually is one of the risks that have been making people more impacted.
But what I'm reading between the lines are, you got to have some follow-up and make sure that people can deliver that in a way that's culturally appropriate too, right?
100%. And that's why the contact tracing that you hear so much about is really about how do you make sure that folks can engage folks who test positive, but do it in a culturally competent way. That's been part of some of the outreach within the Latino community. It's part of what's been important through the Health Commission. You know, we have folks who do contact tracing in 6 different languages. We have folks who represent the diversity of our communities, because you need to not only tell someone that they're positive, but as you're talking with them, connecting with them, you need to make sure that you can explain what is social physical distancing, what does it mean to do some of these pieces, and how do we keep people at risk. You know, if you don't do it in a culturally competent manner, you're going to miss folks, and then folks are not going to get the care that they need. So it's really central to containing COVID, to meet communities where they're at from that perspective.
Well, the other reason you're doing the testing, and maybe this is more about the bigger picture, is that you want to make policies about what's safe to reopen and when. How is this helping you so far?
Yeah, I mean, when you test more folks, you're able to understand what is the true infection rate, right? If you're testing in the low numbers, you really don't get a sense of how far spread it's been or impacted in the community. So for example, we, for quite some time, have been pretty low. We've been under 3% positivity rate for about 8 weeks. And that's great. That's a very low rate. It's manageable. You can contact and trace everyone who tests positive. So if you stay at that kind of rate, you can slowly reopen. And if you think about it, we've had restaurants reopen for quite some time. We've had other entities starting to open. And as long as you make sure that you see the positive test rates stay low and that you can manage the spread of COVID, you can slowly reopen. But it's why you continue to hear us say, practice physical social distancing, wear facial coverings, and get tested if you have any reason to believe that you should, because you've been in groups or you've been in settings with other people. We have to know where we're at so we could truly contain COVID as we try to do some reopening of certain sectors.
Well, there was one targeted testing effort a little after the bulk of the protests in Boston. I think maybe a lot of participants did get tested. Is there any conclusion you're able to draw from the results?
Yeah, I mean, especially with that testing, I think we tested over 1,200 people in 2 days in Roxbury at that testing location, and less than 1% came back positive. So what that shows us a lot is the protests and the marching really didn't do anything to increase the spread of COVID in the community. But it's also really important that people don't just think about those times, but people think about when we've had holidays and things are reopening. We did a lot around after Memorial Day to encourage folks to get tested. You know, as the nice weather's been around and people have been flocking to the beach, we really also want to make sure people get tested if they've been around in groups to create, to ensure that there's, containing the COVID spread if necessary. So what we have seen is, I'm really proud of Bostonians. They're doing a good job. Yes, do we see some images and scenes that we want to see less of? For sure, but Bostonians are doing their very best to continue this flow, which is a low spread in the community, which will be vital as we think about the fall.
Well, I've seen photos from M Street Beach. It is outdoors, maybe some ocean breezes, but almost not a mask in sight. Sometimes they look like they're kind of close together. Are you worried about that?
100%. I mean, we're not only worried about it, but the mayor has said a couple different times that it's really vital that people think about not just themselves at the beach, but who they go back home to, who they might visit, who they connect with. So if you're at a beach and if you're with people, but it's packed, it's busy, we encourage you to think about getting tested. There's 20 different locations across the city of Boston. We have the capacity to test over 2,000 people a day in the city if we really needed to. So we encourage people to get tested. But again, if you're going to go to the beach and you're going to do that, social distancing is key, not only to keep yourself safe, but to keep that activity happening. If the beaches keep being busy, if people keep not following some of the guidelines, you will see some of them close. You will see greater restrictions, and that unfortunately will mean less opportunity to do the things we all want to do.
When I check the figures from the city, I haven't seen anything that looks scary yet, but some of the recent figures from the state, and I know this is all of Massachusetts we're talking about, we have seen a little bit of a pickup in cases, and I think the percentage of people testing positive. Does that concern you at all?
Yeah, it's something we monitor, right? So every 2 days a week, we are doing reports that show us our positive test rate, that show us our positive cases, hospitalizations, as well as those in the ICU. So we monitor that to see if we see any uptick activity. Every day we look at the emergency room data to see if there's any kind of increased folks showing up in the emergency room with COVID-like symptoms. So whenever we see a little bit of an uptick, we of course are concerned. But again, we've done a really good job. We've been under that 3% for a long time now, which is really great. But this is, many times this isn't just a sprint, right? This is a marathon. And so we have to continue to keep up those measures, and we're going to monitor. If we see any kind of increased activity, that's when we'll start to talk about maybe we can't do this or we can't do that as we think about other things and other sectors reopening.
I have to ask you about college students, because even though it's still July, I've heard some backyard parties on Mission Hill. I can't imagine a lot of masks and distancing at those. Yeah. When the school year starts and the testing starts in earnest, do you think that'll be enough of an incentive to make sure the students watch out?
Yeah, I mean, I think it's going to be all hands on deck. the universities, students, the community, really ensuring that as students come back, that we look at the issues that will keep them safe, but at the same time that we make sure they understand the risks that are associated with it. I also think the new travel restrictions that came down from the state involving folks having to quarantine for 14 days when they come in from most states across the country, not a suggestion, but a requirement, will greatly impact students understanding the risks. So I agree with you. I think, you know, the mayor expressed he's concerned about students coming back. We know colleges and universities have worked really hard to try to create a clear plan around testing and tracing, and state guidance hopefully will allow them to have those right plans in place. But yes, of course we're concerned, but we think if we monitor it and put everything in place, we should be able to do what's necessary. But again, there is concern there.
Well, I know the Public Health Commission is still recommending the free testing. So if people want to get some more information about that, is there some place where they can find that along with other updates?
Yeah, the best place to go is to boston.gov/COVID. That's the best place on the city website. It lists not only the locations to get tested, it lists COVID updates and information. And we also list our daily case data and information about our case rates as well as race and ethnicity, so we can see the disproportionate impact and understand what's happening along those fronts. So boston.gov is a great site to do it. If you want to call 311, living in the city, they will also give you the information necessary or connect you to the mayor's helpline to get more information.